Good day, ladies and gentlemen. I'm Dr. Silva, and I'm very pleased and excited to announce the imminent publication of my new online course on conquering anxiety. I've been working on it for several weeks, and it's really turning out very nicely. And I wanted to make an announcement for any viewers that might be interested in pre-registering. Early enrollees are eligible for a discount off the price of this truly transformative course, which consists of a point-by-point roadmap for the individual with severe endogenous anxiety. Anxiety that is innate, biological, inherited, and for which there is an absolute need for medication. Without medication, the anxiety is too disruptive to your life. It significantly diminishes the quality of life. It's those patients who most need medication who respond rapidly and robustly just by taking a pill, because the crux of the problem is a chemical imbalance, for lack of a better term. Various problems with serotonin that lead to these syndromes, which are genetic. Ironically though, it's those patients who often delay in coming to treatment until things are really severe, because for years they didn't even realize anything was wrong, because they've lived with clinically relevant anxiety their entire lives, since they were very young, since they can remember. For them, worrying is normal, it's just life. But the worry is constant, it's daily, and it threatens to overwhelm. And the person doesn't even realize that the majority of it is illusory. It's not even happening. When we worry, it's the what ifs. Anticipatory anxiety, it's truly pointless. Or else it's dwelling on the unfortunate past, being a slave to it. People with this type of anxiety aren't present. They aren't attending to the present moment. They're not being mindful. But it's not until they're having panic attacks, or the intrusive thoughts or the social anxiety have become unbearable, that they finally seek treatment. And sometimes they begin with psychotherapy. When counseling inevitably fails, and they do agree to take medication, many times they do so reluctantly, or if not reluctantly, trepidatiously. These patients worry about everything, and so they worry about the treatment. And anxiety often threatens to sabotage treatment. Anxiety hides, it masquerades, it presents as physical symptoms. It doesn't want to be diagnosed, and then it doesn't want to be treated. These patients have a tough time early on, and this has a lot to do with mistakes that are being made on both sides, including by many practitioners. And so a lot of times these patients eventually drop out of treatment, or sometimes immediately. They'll abort medication trials before adequate therapeutic trials of the medications are completed. I don't know how many patients have told me that they've been on everything and nothing works, or they can't tolerate anything. And when you've been on 20 or 30 different medications, you have not completed 20 to 30 adequate therapeutic trials, because that takes months. And invariably, the majority of those trials were aborted because the patient didn't like the way that they felt, it didn't help their symptoms, or they had deal-breaker side effects. And these patients are extremely sensitive to side effects. They may already be having a lot of physical symptoms, trouble sleeping and such, or headaches or GI disturbances because of their anxiety. Also, they're prone to paradoxical reactions, particularly at the start, and I go into what those are. But if the medication is poorly selected and improperly dosed, you can get the opposite of what we're trying to achieve. Anxiety can increase. And so many of these patients fail treatment. And it's patients who should most benefit from treatment, and they retreat, some considering themselves worse off for having tried. There are a lot of patients out there who feel that they've been in some way permanently damaged by these trials. And I've just met many thousands of patients in all kinds of settings, in the hospital and in the emergency room, but also in my clinic, that they come to me, but they just want a sleeping pill, or they just want medication for ADD. They want treatment for something else. And what they most need, they don't want, because they've heard bad things about it, or they've done research on the internet, or they've had a few bad experiences. And so I've interviewed literally thousands of these kinds of patients that have failed treatment because the treatment was not administered properly. And so that's one outcome. There are other patients with these endogenous syndromes that are able to maintain some form of treatment, but their symptoms are far from being in remission. They're better, but they still have significant residual symptoms that perhaps they believe there's nothing to be done about, or maybe they feel that they can't tolerate more aggressive treatment because of side effects. But if you're someone with severe anxiety, either worried about starting treatment or reluctant to resume treatment, to re-challenge with a certain medication or class of medications, or you're just not getting the results that you want, or you're unhappy with your current regimen for other reasons, including chronic side effects that themselves diminish the quality of life and threaten to be deal breakers, then this course is also for you. Whether or not your condition is purely endogenous, the course is especially germane to those individuals. I wrote it specifically with them in mind, but the pitfalls of early therapy, the do's and the don'ts, the clinical pearls, they apply to all patients. And anyone with severe anxiety can benefit from knowing these strategies and understanding their own reactions, even if your illness didn't necessarily begin in childhood and can't necessarily be traced to one or another parent or is reflected in one or another first-degree relative, like a sibling or a child. If you feel that your treatment course has been difficult, or you have the sense that your current regimen is flawed, but you know you need treatment, yet you're thinking about giving up yet again, or sometimes you forget to take your medicine because really it's been such a poor, disappointing, or unpleasant experience that you're really only partially invested. You're partially in remission, you're partially invested, then this course will also be useful to you. It consists of a syllabus, a simple course outline, there's not a lot of reading, paired with a series of brief 5 to 10 minute videos, nice little digestible chunks of information, the way people like it, which in sequence will take you from describing what anxiety is, in particular endogenous anxiety, and how it behaves, because it behaves differently than garden variety anxiety. For example, the anxiety seen in adjustment disorders, or the quotidian anxiety that doesn't even define a condition that everybody experiences. And this series of video presentations will take you through the process from tips on selecting the right practitioner and how to work with that professional, because the therapeutic relationship, the therapeutic alliance is everything. And the process should be a collaboration. It's not a dictatorship. The provider can't do it without you. Treatment must be individualized. So I talk about all of that, and each video focuses on one specific topic. In 5 to 10 minutes, you get the take-home message, the distilled topic, the specific rationale for selecting the right medication according to target symptoms, what the diagnosis is, what diagnoses in psychiatry are, what they mean, how they're derived, and then specific clinical pearls for both patients and also you students and trainees out there regarding dosing and titrating medication, how to mitigate paradoxical reactions, what they are, how not only to manage side effects, but how to obviate them entirely where possible, how to get to remission, and how to know you're in remission versus recognizing partial remission, and so much more, including a discussion on non-pharmacological remedies, psychological strategies, and important lifestyle tactics that you have to pair with the medication. Once finished, the course will be self-paced, and you'll always have access to this exclusive content so you can watch them as many times as you want. But if you pre-register, then you're more than welcome to review the material as it's released over the next few months. So I'll release it just as each video is ready. It is a work in progress. If you're interested, there's a link in this description that will take you to my online school, Not on an Empty Mind, and you can pre-register. There's no obligation. Registration is free. You don't have to buy now. If you think that you may be interested once the course is made available and you want to be on the mailing list, then please sign up. And if you do want to purchase now, if you know that you're going to want access, you can use a coupon, Anxiety Master, to get a $100 discount off the cost of the course. And that's for those individuals who pre-register and pre-purchase within the next couple of weeks, within the next month, before I actually release the first video, which will probably be in about a month. And then the schedule will be at least one video per week. If you want a preview of the kind of information this course contains, then I recommend that you check out a couple of videos in my anxiety disorders playlist, Anxiety Generations and The Secret Nature of Anxiety. If you haven't seen those, I encourage you to check them out. They'll give you an idea of the kind of material that you're going to have, and also my presentation style if you're not familiar with my videos. As always, thank you for watching. Comments and questions are welcome.